Hello, my name is Rachel. Today we're going to talk about procedure of pregnancy and childbirth. All right, so first we're going to do the description of pregnancy. So pregnancy is the term used to describe the period in which a fetus develops inside a woman's womb or uterus. Pregnancy usually lasts about 40 weeks or just over 9 months, as measured from the last menstrual period to delivery. Healthcare providers refer to 3 segments of pregnancy called trimesters. All right, childbirth. Childbirth is also known as labor, parturition, and delivery. Is a completion of pregnancy where one or more babies exist the internal environment of the mother via vaginal delivery or cesarean section. In 2019, there were about 140 million human births globally. In the developed countries, most delivery occur in hospitals, while in the developing countries, most are home births. The most common childbirth method worldwide is vaginal delivery. Vaginal delivery is generally recommended as a first option. Cesarean section can lead to increased risk of complication and significantly slower recovery. There are also many natural benefits of a vaginal delivery in both mother and baby. Each year, complications from pregnancy and childbirth result about 500,000 birthing deaths, 7 million women have serious long-term problems, and 50 million women giving birth have negative health outcomes following delivery, most of which occur in the developing world. Complications in the mother include obstructed labor, postpartum bleeding, eclampsia, and postpartum infections. Complication in the baby includes lack of oxygen at birth, birth trauma, and prematurity. All right, so now the importance of pregnancy and childbirth. The birth of a child, it's pivotal time in the life of a mother and her family. The health and well-being of a mother and a child at birth largely determines the future health and wellness of the entire family. The outcome of childbirth, however, is not the only factor of importance in a mother's well-being. Some research suggests that the way in which a woman experiences pregnancy and childbirth is also vitally important for a mother's relationship with her child and her future childbearing experience. Thank you.
Good afternoon, my name is Liliana Taracia Garosuero. Today we're going to talk about the fetal development and the stages. In the first week, we have weeks 1 to 4. In this stage, we have the conception. The fertilization typically occurs in the fallopian tube. Implantation. The blastocyst implants into the uterine lining. Early development. Cells differently into the embryo and placenta. The amniotic sac forms, providing a protective environment. We have weeks 5 to 8, hair and circulatory system. The heart begins to beat around the week 5. Neural tubes, the brain, the spinal cord, and the other nucleus tissues form. Limbs, buds, early formation of arms and legs, or early formation of arms and legs. Major organs, like upper bodies. We have the liver, the kidneys, and the small intestine and large intestine. They start to develop. Week 9 to 12, facial features. We have eyes, nose, and mouth become more distant. Genital. Development of external genital through sex is not distinguishable by the ultrasound until later. Movement. The fetus starts to make small movements all through the mother, but the mother cannot feel them then yet. Hormonals. We have increased levels of hormones like HCG, estrogen, and progesterone. Morning sickness often peaks around weeks 8 to 10. Emotional changes. Mood swings due to hormone fluctuations. Weeks 13 to 16, growth. The fetus grows rapidly, and the head becomes more proportional to the body. Skeletal system. Bones continue to harden. Skin, thin, transparent skin forms. Weeks 17 to 20, movement begins to feel fetal movements, like the mother. Sensory developments. Ears and eyes continue to develop. Reproductive system. Development of the testes or ovaries. Weight gain. The fetus The fetus gains more weight and develops more muscles. Hair growth. Fine hair covers the body, and the scalp hair grows long. Begin to produce surfactants, which is crucial for the breeding after birth. Weeks 25 to 26, hearing. The fetus can respond to sounds. Viability. By week 24, the fetus has a chance of survival if born permanently, with intensive medical care, or maternal changes. We have energy levels, often increased compared of the first semester. We have physical changes, enlarging abdomen, possible darkening or darkening skin, and develop of stretch marks, discomforts, back pain, leg cramps, and Braxton Hicks contractions. Weeks 23 to 31, 32. Brain development, rapid growth, and increased brain activity. Fat, accumulation of the body fat to regulate the body temperature post-birth. Plexus, development of rooting and sucking reflexes. Week 33 to 36. Positioning, the fetus moves into the head-down position for birth. Lungs, further maturation of the lungs in the preparation of the breathing. Weeks 37 to 40. Full term. The fetus is considered full term by week 37. Final preparations. The fetus continues to grow and gain weight, practicing movements such as breathing, sucking, and blinking. Maternal changes. Physical discomfort, increased back pain, pelvic pressure, and sleeping. Braxton Hicks, frequent and intensive as the body prepares for that. Nesting instinct, a surge of energy and desire to prepare the home of the body. Labor stages. We have early labor, dilatation, and effacement. The cervix begins to open, dilate, and thin out the face. Contractions. Mild and regular, initially becoming more consistent. Active labor. Intensive contraction, more painful and closer together. Transitions. The final stage of active labor where the cervix dilates from 8 to 10 centimeters or inches is often the most intensive part of the labor. Thanks for listening.
Hello everyone, my name is Arlene Garcia and I'm going to talk about the science of labor. Signs of labor refer to the physical and physiological changes that indicate the onset of childbirth. These signs can include regular contractions, rupture of membranes, also known as the water breaking, and the passage of the bloody show. Recognizing these signs is important for determining when labor has begun and for seeking appropriate medical attention to ensure a safe delivery. Here's an explanation of each sign of labor. Number 1. Regular contractions. These are rhythmic tightening and releasing of the uterine muscles causing the cervix to dilate and effect. Through labor, contractions become increasingly stronger, longer, and closer together over time. Contractions help push the baby down the birth canal. Number 2. Rupture of membranes, also known as water breaking. This occurs when the amniotic sac surrounding the baby ruptures, releasing amniotic fluid. It can happen as a sudden gush or slow trickle of fluid. Not all labors start with the water breaking. Sometimes it occurs later in labor or even after contractions have begun. Number 3. Bloody show. This refers to the passage of a small amount of blood-tint mucus from the vagina. It's caused by the separation of the mucus plug, which seals the cervix during pregnancy. As the cervix begins to soften and dilate, it's usually a sign that labor is imminent or has already begun. Here's why it's important. Number 1, safety. Timely recognition of labor signs allows healthcare providers to monitor the progress of labor and ensure that both mother and baby are safe throughout the birthing process. This includes monitoring vital signs, fetal heart rate, and the mother's overall health to address any complication that may arise. Number 2, prevention of complication. Prompt medical attention can help prevent or manage potential complications that may occur during labor. For example, if the baby is in distress or if there are signs of fetal distress, medical intervention may be necessary to ensure a safe delivery. Number 3, timing of interventions. Certain medical interventions, such as administering pain relief or assisting with the delivery, may be more effective when performed at a specific stage of labor. Recognizing the signs of labor allows healthcare providers to time interventions appropriately, optimizing outcomes for both mother and baby. In summary, recognizing the signs of labor and seeking medical attention promptly ensures the safety of both the mother and the baby, facilitates timely interventions to prevent complications, provide support and guidance during childbirth, and allows for proper preparation for the birthing process. Thank you.
Okay, hello everyone. My name is Ashley Castro, and today I'm talking about the stage of labor. And labor is the process through which the baby and placenta are delivered from the uterus through the birth canal. Labor is typically divided into 3 main stages, and you can see this stage in a summary picture. Now I'm talking more about this stage. Okay, first stage, early labor and active labor. Early labor, latent phase, duration this phase can last from several hours to days. Cervical dilatation, the cervix dilates from 0 to about 4 to 6 centimeters. Contractions, mild and irregular, becoming more regular and stronger over time. Active phase. The cervix dilates from about 4 centimeters to 10 centimeters. It's become thinner and retreat phases until it joins with the rest of the uterus. The baby's present part, the part of the baby that will be delivered first, usually the head, begins to move down the spectrum more mother pelvis. And the woman begins to feel the need to push as the baby descends, but must resist until the cervix is fully dilated. Duration typically lasts from 4 to 8 hours, and Here you can see a picture how the cervix are fully or completely, or almost completely dilated. Okay, the second stage from complete dilatation of the cervix to the birth of the baby. This stage usually lasts approximately 2 hours in a first pregnancy and approximately 1 hour in the subsequent pregnancies. It may last an hour or more if the woman has had an epidural injection to relieve pain. During this stage, the woman pushes. This stage can last from a few minutes to several hours, and cervical dilatation fully dilated 10 centimeters. Okay, the next is third stage. From the birth of the baby to the expulsion of the placenta, this stage usually lasts a few minutes, although it can last up to 30 minutes. And postpartum stage, sometimes referred to as the fourth stage of labor. This period involves the immediate post-delivery phase where the mother and baby are monitored to ensure they are both stable. It includes managing bleeding, checking vital signs, and beginning the bonding process. So that is all, and thank you for watching. Bye.
Hello, I am Yasmin Perez, and I'm going to talk to you about recovery after childbirth. After childbirth, the woman experiences both physical and emotional changes. The physical ones are, number 1, recovery of the uterus, number 2, postpartum bleeding, number 3, breast changes, number 4, pain and discomfort, number 5, weight loss, number 6, hormonal changes, and number 7, urinary and digestive problems. In the emotional ones is number 1, baby blues, that is sadness and anxiety, and irritability all together. Number 2, postpartum depression. Number 3, change in identify. And number 4, maternal bond. If a woman experiences severe persistent symptoms of depression or anxiety, it is essential to seek professional help. Importance of the mother's recovery after childbirth. The mother's recovery after childbirth is essential for the physical and emotional health, which has a direct impact on the well-being and development of the baby. A recovered and healthy mother can better play her role and enjoy motherhood more fully. It helps you have good emotional stability, have a bond between mother and baby, and have self-esteem and confidence. It also helps the baby have successful breastfeeding.